Well, good afternoon, everybody. My name is John Corlett. I'm the president of the Center for Community Solutions, and I want to welcome you to our Friday webinar on the impact of COVID-19 on the LGBTQ community. We think this is a really important topic, and we're so pleased to be joined by such smart and important people to help us understand this a little bit better. I think it's, I hope, it's well known and understood that the LGBTQ community is disproportionately impacted by this epidemic for a variety of reasons. And our speakers are going to sort of cover some of that today. Next slide. Danny, you want to forward the slide? There we go, thanks. And this just gives you a little bit of information, if you don't know it, about the Center for Community Solutions. We're a nonpartisan nonprofit that aims to improve health, social, and economic conditions through nonpartisan research, policy, analysis, communications, and advocacy. So I'm going to introduce our presenters that we have today, and then they're going to take it from there. So I think first today we're going to hear from Charlotte Floor. She's the research manager for the Human Rights Campaign Foundation, a really important organization, and they do really important research. Maya Simic is the legal director of Equality Ohio, a really important group here in Ohio that works to advance these issues on a state level. And then Gulnar Farista, who's the director of programs for the Lesbian, Gay, Bisexual, Transgender Community Center of Greater Cleveland, one of our favorite organizations in Cleveland. We're so happy to have Gulnar with us today. So I think we're going to start with Charlotte, and Danny, you can advance the slides.
Thanks for that introduction. My name is Charlotte Floor. I use she, her pronouns. I'm with Human Rights Campaign Foundation, which is the public education and research arm of Human Rights Campaign. For those that don't know, that's the nation's largest organization that fights for lesbian, gay, bi, trans, and queer equality. Particularly on the foundation, we work to improve the lives of LGBTQ people in the daily parts of their lives, whether it's in their workplaces, where they worship, or where they go to school. We're working to change policy and practices to better reflect the needs and experiences of the community broadly. Today, we're going to be talking about a part of our work around the corona economy, and specifically how LGBTQ people have been economically impacted by the coronavirus since its onset in January and February. Next slide, please. Awesome. So we're going to kind of walk through a little bit of a story with a lot of data that HRC has been looking at that not only we've analyzed, but folks across a wide variety of organizations. The first part is going to be about the warning signs and the red flags, talking about what exactly puts the community at risk and why we thought back in March that the community would have adverse outcomes as this pandemic unfolded. And then we're going to move into the national economic fallout, and both what that means for the country on a national kind of macro level, but also what it means for LGBTQ people and their kind of employment and financial lives. Next slide, please. Awesome. So like I said, back in early March, Human Rights Campaign Foundation released a groundbreaking issue brief where we outlined a wide variety of risks that were going to present the community as the pandemic started to unfold. And one of those things was that the community was at greater economic risk. And they're at greater economic risk for a whole host of reasons that I'm going to talk about now. Next, please. Awesome. You can think about the economic risk of the community during the pandemic as a chain of economic events. People who are living in poverty or people who are living near poverty, when there's an economic crisis, they're more likely to feel the sting of that crisis. That's not to say that folks across the board are not feeling things, but it has a bit of a harder punch for people who are already struggling. And in particular for people who are struggling, when we think about this pandemic, they're going to be less likely to have resources that are going to allow them to combat a lot of the economic side effects. And so namely, two things are really central here. That's access to health insurance coverage, and that's access to paid leave, specifically paid medical leave benefits. And then lastly, one thing we need to keep in mind, which surrounds both why people are living in poverty or near poverty, as well as why they don't have access to resources that buffer them from the negative effects of this pandemic, is also where people work. And as we'll see, LGBTQ people work predominantly in industries and areas where the pandemic has hit hardest for a wide variety of reasons. So now I want to talk about some of the data, right, to kind of put some more punch to what we're saying here. More than a fifth of LGBTQ people, according to a Williams Institute report that was issued in October, are living in poverty. This is greater than the rates that we see for non-LGBTQ people. And so this is going to have broad implications for their access to resources. Next slide. I want to take a little bit of a deeper look into the poverty stats before we look at other factors to talk about. And that's specifically one that calls attention to this idea that people who hold what we call multiple marginalized identities. So people who aren't just, people are not just one identity. We're not just women. We're not just gay. We're not just transgender. We're a lot of different things at the same time. And so when we think about communities that have historically been kind of cast off to the side and marginalized in society, we're going to see that their risk is, of course, some of the greatest. And so what this chart kind of shows in that kind of staircase you can see is that when we look at specifically trans people of color and trans Black people, they're some of the most likely, about 40%, to be living in poverty. And again, like I said, this has implications for their access to resources to combat the side effects of this pandemic. Next slide, please. So thinking from there, right? So one, why are folks living in poverty and why don't they have access to these resources? It's because of where LGBTQ people work. HRC Foundation estimates that 40%, so 4 out of every 10 of LGBTQ adults working are in roughly 4 areas. They're in restaurants and food services, they're in hospitals, they're in K through 12 and higher education, and they're in retail, accounting for about 5 million LGBTQ workers. And specifically, right, a fifth of them, they're working in an area where they're more likely to have lower wages and less access to benefits that come along with employment. And that's restaurant and food services, as well as retail workers. Next slide, please. So it should come to no surprise when I show you these numbers right here that almost a fifth of LGBTQ people don't have health insurance coverage. About 8% of the general population doesn't have health insurance coverage. So we see that the community is about twice as likely to not be covered. That has implications for the well-being, financial well-being of the community. When you are, like, God forbid, should you have to go into an intensive care unit because you contract the coronavirus and you don't have health insurance, that's going to have very serious implications for the amount of medical debt and bills you're going to rack up. And people can't pay them back, especially if they don't have health insurance coverage. And then second to that as well is we, back in 2018 at HRC, did a survey on paid leave, trying to understand the community's access to paid leave benefits. Less than a third of folks who took that survey did not have access to paid medical leave. So should someone want to quarantine themselves, they might have to take unpaid leave, which has implications for their financial well-being. And should they actually be sick, they again don't have the option to take paid medical leave, in addition to probably not having health insurance coverage. So we kind of have like this cocktail of this very serious risk, which, as we'll see, have played out into the economic impact of the virus. Next slide. So, like I said, there's these risks, there's an impact on the community in terms of their financial well-being, and that's directly linked to the fact that during this pandemic, the economy has tanked. There's no other way to really put it, and it's tanked on multiple levels. It's tanked on broad levels when we think about measurements like GDP, which talk about the country's economic activity as a whole. But it also is important when thinking about the individual level, what's going on in community members' individual lives and employment outcomes. Next slide. So the financial system is kind of broken up into quarters for those that don't know. We have 4 quarters and we try to increase GDP each quarter to contribute to what we call economic growth. Now, some people don't think economic growth and GDP are good measures, and that's valid. I think it's just one part of the story here. From the first to second quarter, so when we look at what happened in the second quarter, GDP in the US fell by 33% of what it was in the first. This is involving billions and trillions of dollars of loss of economic activity. And so that's going to have broader implications from the macro level into the micro level of the community's daily lives. Next slide. So what did HRC do? We partnered with a global analytics firm, PSB Insights, and we've so far have surveyed 10,000 adults. And we looked specifically at LGBTQ people's employment outcomes and their financial situations as the pandemic has unfolded. Half of LGBTQ people in our survey said that they had a negative outcome in their employment since the start of the pandemic. This could be anything from a quarter or more of people, LGBTQ people, saying they had their work hours reduced. Almost a fifth have lost their jobs. And about 1 in 20 have had to take unpaid leave. And of course, as you would expect, when we think about communities who are Black or people of color, as well as trans communities, they're more likely to experience these outcomes as well. Next slide. And that's kind of what this graph right here is again getting at, similar to what we saw in the poverty chart from before, right? Groups with higher poverty rates, as you can see here, are also having higher rates of becoming unemployed. When we look at like the number for the trans people of color who've come unemployed, that's a quarter of trans people of color who said they became unemployed since the start of the pandemic. That's a lot of jobs being lost, to kind of put it in context. Next slide. I think kind of like a final bit of data to leave here before I pass it over to my co-presenter is to also think about the financial stress component, and again, that intersectional idea about folks who are most marginalized are feeling the brunt of the economic impact here. So looking at folks who've had to ask for delays in paying rent, right? Because people are losing their jobs, they're also having their work hours reduced, and in some cases they're taking pay cuts. They have to figure out how to pay their bills one way or another, and sometimes that includes having to ask for delays in paying rent. So in our sample, only 7% of all the adults in the sample said that they had asked for a delay in paying the rent. That number jumps up a little bit when we look at just LGBTQ people, to about 11%, but then we see almost a 2 to 3 times increase in folks saying they have asked for delays in paying their rent when we look at Black LGBTQ adults. And what we know, HRC has also issued research briefs about particularly the impact of the pandemic on Black LGBTQ people. And what we know is that on both health and economic levels, the Black community has been dealing with a lot of both the health and economic consequences of this pandemic for various reasons tied to systemic racism and a whole host of other factors. I want to leave it here because I know we don't have much time, but I will go ahead and pass the presentation over to my co-presenter, Maya.
Thank you so much, Charlie. All right, so hello everyone, my name is Maya Simic and I am the Legal Director at Equality Ohio. I am excited today to speak to you a little bit about some of what we have been seeing at our legal clinic. Equality Ohio is the only statewide LGBTQ organization, and we focus on identifying and transforming systems and institutions so that LGBTQ plus Ohioans can fully access legal and lived equality, and we do that through legislative equality as well as through our legal clinic. Next slide, please. So about a year ago in 2019, we actually had just started our legal clinic. It was March of 2019, and our hope was that we would be able to work on some of the elements of law which would help individuals stabilize. So we call it stabilization law. And we see stabilization areas as areas which are preventing someone from moving forward. That would be a barrier to thriving and flourishing. And so we ended up engaging in a 1-year systemic strategic plan asking members of the community how we could best be of service. Next slide, please. So the areas of law that we ended up falling on based on those survey results are listed here, and there's quite a few of them. And so we ended up hiring some attorneys that we love to call our Swiss Army knife attorneys. They have a lot of tools in their toolkits that they pull out in order to try to help someone identify what legal area they need assistance with, as well as to help remedy some of those hurdles. So you can see up here we have everything from criminal justice advocacy, temporary protection orders, to family law cases, to landlord-tenant, to some EEOC, which is the Equal Employment Opportunity Commission mediation. That is when someone maybe experiences some discrimination for housing or access to public accommodations. And then we also have items such as advocacy for name and gender marker changes. Next slide, please. And our clinic can be accessed online and through a 1-800 number, but just to give you a little bit of background information, you can access our intake form there, as well as some Know Your Rights videos and pamphlets and blogs and legal updates. Next slide. Thank you. So we're going to go over a little bit about what we've been seeing and what has changed for us since our opening about 1.5 years ago, and what happened as soon as COVID had happened and the impact. Next slide. So building off of a little bit of what we saw with Charlie speaking, there are a lot of exacerbated vulnerabilities that occur within the LGBTQ community. So just walking in to the pandemic, we have a community, we are a community that experiences a heightened vulnerability in all of the little panels that you're seeing on the screen. So we have heightened rates that are echoed in national statistics ranging from the Center for Disease Control to the National Institution of Mental Health, higher rates of mental health comorbidities, higher rates of homelessness, higher rates of suicidality, higher rates of survival crime conviction. And what is a survival crime conviction? A survival crime conviction is someone who is charged with a crime that they engaged with in order to survive. So for example, theft crimes, prostitution, sex, survival sex, breaking and entering can be a survival crime. So just going into the pandemic, we already had higher rates here. We had higher rates of substance use, we had higher rates of HIV, and we had higher rates of domestic violence, just to name a few. So knowing that this is the ground we're working with, I think it's just an important background. Next slide, please. Thank you. Something else that's very important is that there has been a lot of heightened rates of murder within the community of our Black trans women. And Ohio, unfortunately, has been a part of the community that has seen a great upsurge in cases of women being murdered. And so two of the women that you'll see here, one is actually from Philadelphia and one is from Cincinnati. They were murdered within 24 hours of each other just in June. And I say this to say there's the context in which we're also looking at everything else going on historically and culturally, is that we have Black trans women that are being murdered in Ohio. No less than 12 since 2013 have been murdered that we are aware of. And I say that we're aware of because often the media does not report correctly when someone is a member of the community, and often that is not always publicized. But just what we know, we have very violent implications for members of the transgender community, and Ohio is not doing well at protecting our transgender sisters. Next slide. The other item that we're bringing into this contextually is police brutality, and we have a very contentious relationship within the LGBT community stemming back. Everyone likes to talk about Stonewall, and Stonewall is a very important part of our history, but 40 years before that, we have been having riots with what was happening with the LGBTQ community and the police, where there were sit-ons at counters of people trying to get access to services, right? And the reason, as we start looking at this contextually, is like just to be a member of the LGBTQ community was illegal for so very long. And so when you're looking at systems that you think of who should be helping out, there has been systemic mistrust and an inability to reach out to folks who should be able to help you. So when you couple this with the history and the context of race, of how we're reaching out, and of these systemic vulnerabilities, you begin to see why there's a sense of problems that we have accessing helping assistance systems. Next slide, please. So we're going into the pandemic, and when we're going into the pandemic, we're trying to look at how we're reaching out to folks and how we are able to get people access to systems. And what we saw is that, again, with the basis of systems being scary, not addressing and not appropriate, and not necessarily meeting people where they are from the get-go, we still saw that our caseload, our legal intake caseload, tripled within so from March forward, our caseload started tripling from the amount of numbers of cases that we saw actually accessing our intake systems. We were also very aware that we were trying our best to reach out to folks in the community, and so we tried to go online, whereas we used to have intake that was in person at wonderful locations like the LGBTQ Center in Cleveland, for example. We were no longer able to do that because it wasn't something that we could do for the health and safety of people. So how could we reach out? We tried doing virtual hours and telephonic hours, and we did online Know Your Rights systems, but there is a presumption there that people had access to a stabilized internet, which we know just isn't accurate, right? And so we did our best to try to update, and we were painfully aware of those people that we weren't able to reach out to. Next slide, please. So some of the court system challenges that we saw as we were working with folks from a legal process is we saw delay in non-essential matters. And what that means is that the courts had the option to shut down. And shut down, most of them did across the state. And I say most because not all of them did, which led to a lot of discordant information, messaging, and understanding of when you were supposed to show up, when you were not supposed to show up, and who was doing what, right? So that's very challenging. But ultimately, even if a court did stay open, more often than not, you're going to see there is an extreme backlog in cases, and cases that people were really depending on moving forward. So for example, divorces. Divorces were put on hold in Cuyahoga County minimally for a while we're figuring out how to access it electronically. And other kinds of cases that required, let's say, a jury trial, those were put on hold. A lot of systems and cases were put on hold that meant people could not move forward with their life, which was very hard to handle on top of everything else going on. We had an inability for people to access identification documents and systems, which can be very dangerous for members of our community who need to update their documents, particularly when they're going through gender affirmation care. We had problems with applying for unemployment benefits. And aside from the general problems that we saw across the state with a backlog and people having a hard time accessing the system, we saw people who had names that had been changed through an official court proceeding still not being able to access the system and being told that they were fraudulently trying to access the system, even where they had updated their names in the systems that they were told that they needed to. So for a lot of our transgender clients who had come to the door saying, what is happening here? I've done all of the things. We then had to figure out ways to work with the Department of Jobs and Family Services to say, hey, how can we help here? And then we had people within that pool who said, I don't have access to whatever you need to verify this because it's the pandemic, and the places I could request those pieces of paper, those documents from, are no longer open. So for example, we had a client who needed a birth certificate in order to prove that they were who they said they were, and we couldn't get the birth certificate, right? And so we were having a very heightened level of folks who were unable to support themselves trying to access a system that was supposed to help mitigate that, and we're having hurdles on their gender identity markers. Just on top of that, a lot of these were exacerbated by a lack of ability to access affirming care, right? And so gender affirming care, going into spaces where someone saw you and knew how to address you, but also gave you access to the health care that you needed. Let's say you had ongoing preventive care. Let's say you had HIV. Let's say you had a need of hormones. that became extremely problematic and challenging for folks. And so there was a navigation between not also getting your healthcare needs met and what that did in terms of impacting the rest of you and the legal systems. So this exacerbation of loneliness, isolation, vulnerability also cannot be taken without the context of how it impacts other legal elements you have, because people are people, and we, in a holistic world, we need to consider the whole system of a person, which is legal plus, right? And at the end of the day, the courts did start adjusting, which was lovely, but they started adjusting, and then some of their adaptations, again, were not necessarily encompassing of people who did not have stabilized phone or internet systems, which means we were still stuck with a lack of an access to justice. Next slide, please. So some of the other considerations that we had were that the victim services operations had limited staff or staff who weren't working from home. And a lot of the accessibility that we spoke of became limited. So I know a lot of people who had Social Security benefits wanted to go into the office if there was a problem that happened, and they were no longer able to do so. Our Social Security hearings transitioned from in-person or video to telephonic only because the offices were no longer open at all. And so people weren't able necessarily to get assistance, and the wait times on phones, very, very cumbersome and burdensome. Also, there's just an inherent misunderstanding of all of these changes of laws that were occurring that don't necessarily get handed down to folks in a way that are easy to digest and understandable. So can you evict me or can you not evict me right now? What is a moratorium for an eviction, and how am I supposed to get access to that? So like, does that mean I can stay here and I shouldn't pay my rent? But people don't know that if you don't pay your rent, ultimately it's a grounds for eviction anyway, moving forward, right? And so the way the messaging came through media and how people took that in and perceived it was very hard to combat, because everyone is just trying to reach out and figure out what they needed to do. So even if we have folks who weren't immediately evicted, we now know that we may have a impending wave of evictions coming on because people weren't necessarily given information in the way that they were able to retain or receive. Next slide, please. So what happened with the courts? This is a big thing, and I don't know what it looked like anywhere else, but Ohio was just a bunch of systems figuring it out as they went, which meant that, again, there was no congruency. And we switched over to a lot of audiovisual mechanisms, which has good and bad sides. We had a lot of trials, civil and criminal, suspended. Non-essential hearings were shut down. We also had the requirements of temperatures and face masks that were required just to enter these systems. Which means you could be turned away at the door, or you had to be comfortable necessarily walking up to someone and having them evaluate your physicality in order to go into an already uncomfortable and anxiety-producing state. And finally, access was reduced for people who didn't have appointments, and so people who would actually go and try to seek assistance from justice-serving organizations would often be turned away if they did not have a pre-screened appointment. Next slide, please. So the other big challenges we saw, so we talked about domestic violence, right? And how we had walked into the pandemic with exacerbated rates within the LGBTQ community. When you're looking at trying to establish, and we know, and we've all seen the reports, that domestic violence and problems with parenting and co-parenting and all of the stressors that have been a part of the pandemic means that sometimes people were not being their best selves and were not able to. And what that meant is if you were trying to work towards domestic violence assistance, or you were trying to get evidence, there was a really big problem in obtaining access to documentation that would help support your causes, right? So getting access to police reports, getting access to medical documents, getting access to witnesses, right? Those are all three things that are not easy on any great day, but now, right, in the current state have gotten increasingly more difficult. How do you file if you're not able to go on into a system in person? And when people are working from home, what does it look like for you to tell your very personal stories to someone over the telephone that you have never met and cannot see? And understanding we already have that underlying distrust of systems that haven't necessarily been kind to people. Next slide, please. focusing on specifically domestic violence, another thing that we had wanted to talk about is a lot of the folks that we saw that came in who were having access to some of these problems had some concerns about things like parenting plans, right? So my co-parent is an essential worker and I don't want them to have my child anymore. What happens if I just remove them from the house? And because I'm not allowed to modify my parenting plan right now because the court doesn't deem that as essential, right? So who deems what as essential to a person and how that feels when they're told that their very important issue to them is not essential? And to be clear, it's very essential, right? But it wasn't for the health of the court system at that time. So what do you do with that? How do you modify that? And how many people couldn't get an answer calling in and had to go it alone? So trying to navigate with us with how to communicate with different parties, what it looked like, and how we were getting creative with who we could get access to, how and when and why. It was very upsetting. We also saw, although we know that domestic violence typically has some problems with prosecution and arrest, during this time there has been a lot of our clients reporting that in the event of physicality or issues with people becoming physically violent, there was not a system that was supposed to be there to assist when that system was called. And so what do you do when you are also calling and no one is coming to help you? At the point in time you have actually worked yourself up into the courage to call and ask for assistance. And so we have seen some places where we have also started to unravel trust even more so in systems, because at a time when people have more desperately needed them, they're not showing up. So next slide, please. I think that is all that I have for right now. I do want to say that we know that it's just begun. And of the cases that we are seeing and experiencing, we know that we anticipate the landlord-tenant problems, for example. We're just at the crest of the wave, and several of the other items as well. And so we just hope and ask that people keep working and coming and asking us how we can be, or telling us how we can be of best assistance with them, and seek the wonderful supportive services of the folks at the LGBTQ Center, who will tell you all about what they do. I'm going to turn it over to Gulnar.
Thanks, Maya. Hi, everyone. I'm the Director of Programs at the LGBT Center. And we can move to the next slide. The way that I want to share this information with you is through the lens of intersectionality, because everything that we do at the center is really influenced by the way in which people navigate systems and society. So there's some key themes that we are seeing that is really shaping our work and in the way that we are evolving to serve the needs of the community. We're seeing a really big increase in the need for direct services. We are back open. We reopened with limited hours in June 1st, and then July 1st, we reopened at full capacity. So 10 to 8, Monday to Friday, Saturday 10 to 2. But when in doing that, we had to be really intentional and really pay attention to how we were creating safer spaces for in-person programming. And I'm going to talk a little bit more about that as we go through the slides. We have redesigned our programs to meet the needs of folks in this time of social distancing. I don't know why my computer keeps going off with all these notifications. I apologize. I don't know how to turn that off. And then we're seeing a huge shift in our approach to addressing these systemic barriers, including systemic racism, that we've always paid attention to and addressed as the center in terms of our advocacy and activism. But we are seeing a bigger focus in the social conversation around this. And so, you know, it's definitely influencing the way in which we are approaching this conversation in the broader social sphere. And then the biggest thing that we're seeing is community-wide grief. And this is not just in terms of, you know, people losing family members and loved ones, but it's also the loss of space, loss of access, loss of culture and social outlets. So those are some of the key themes that we're seeing in our work at the center. And again, I want to say that we're going to, the way that I want to approach this presentation is to really look at it through the lens of intersectionality. Next slide, please. So what are we observing? And we can go to the next slide. I'm gonna be, so this is, you know, from conversations that we are having with all our community partners, and also what we are seeing at the center. Some of these things my co-panelists have already talked a little bit about, Charlie and Maya. But I, you know, want to really emphasize the fact that our community members are experiencing the brunt of the pandemic in terms of adverse outcomes. Like Charlie mentioned, they are mostly essential workers, frontline workers, and social service providers. And so there are multiple intersectionalities and layers to the way that we are experiencing the pandemic. We are not only just workers, we are also frequently caregivers of our own children, of our family members, our chosen family members, elders, other folks with different abilities in our chosen families. We also predominantly have the largest number of folks that are either HIV positive or living with HIV, or having comorbidities, other immunocompromising conditions, underlying conditions. And so that adds another layer of safety planning and concern when we are trying to navigate in the larger social context. And, you know, because we are mostly frontline workers living paycheck to paycheck, often with very little, you know, things like savings or retirement plans or sick leave, medical leave, we are having to work and we often don't have options. So this is causing an other added layer of stress in not just financial stress, but also emotional, physical, mental stress. This also speaks to the existing disparities in our community, but especially so. So like you have one already layer of disparity right there as queer folk, but then an additional layer of disparity when you think about it in terms of queer people of color, you know, in Black, Indigenous, other group, minority groups. And so these have been further exacerbated by the pandemic, which has then significant long-term outcomes for an already ultra marginalized community. Our healthcare partners especially have pointed out this really big stark divide that they're seeing in the patients that they are treating based on race and geography. And so this has been really interesting to learn for us anyway, that they in terms of, you know, those that are rural, our community members are having to deal with anti-masking family members who you know, kind of think that masking is not really going to work, or you don't have to wear a face mask. There's a lot of people that are into these fringe internet conspiracy theories. And there's just this basic inherent resistance to safety protocols. So in addition to not just having to navigate life in society as queer folk in rural areas where you're already isolated and have limited access to care in general, you're also having to navigate these sort of social trends, right, in your life. And then in terms of our queer folk of color, Black queer folk, you are we're seeing that they're experiencing a disproportionate loss in terms of losing family members, loved ones to COVID, and they are this is really important and heartbreaking, is that, you know, they're trying to grieve while at the same time they're not able to have any sort of closure, because you're not able to be in the hospital to say goodbye. Often you're not able to even have a proper funeral or a burial service, because again of the health restrictions and the safety guidelines. And so these are all combined, taking a really huge toll on the community. Next slide. And so, you know, healthcare is not just physical, it's also mental. We are all, so again, Charlie and Maya already spoke to this, but I just want to emphasize the fact that we already come from situations and environments where we are already experiencing predominantly, so it's not across the board, and I don't want to use this broad brush across the entire community, but for the majority of us, there's a lot of lack of acceptance in our home lives. Our social lives are often organized around our chosen families, folks that we have you know, formed close-knit relationships with in our communities, who serve as our pseudo family members, because we just don't have those ties of kinship with our blood family. And so while they don't reside in our homes, they reside in, you know, close by, we haven't been able to interact with them physically because of social distancing. And so this has caused a huge sense of isolation and loneliness and significant despair and desolation for folks that are already so marginalized and live on the fringes of society. And this has been really significant for our youth, because for them, often while they are at home, their homes are not necessarily safe for them or accepting or affirming for them. And before, where they could come to the center or go to other spaces where maybe they could get a break, or they could come be their authentic selves, they don't have that anymore. For example, we have youth in our youth program or in our trans wellness program that are young adults, right? And they will leave their clothes and their wigs here at the center in our care, and they will come in what they call their street clothes, and they will come in, the first thing they'll do is they'll either go to our youth coordinators or to Divinity, and they'll grab their stuff, they'll change, and they'll come out dressed as their authentic selves. And you see this huge weight lift off them. And they'll be here for like 3 hours or 4 hours or however long that they can be here. And then when it's time to leave, for them to get on the bus or whatever, you see their shoulders slump, they'll go, they'll change, they'll come give us their wig, their article of clothing. These are their most prized possessions. And they will come and give them back to us and leave them in our care until the next time that they can be here and wear those things again. And now they don't have access to something that is so precious to them. And so, you know, when you think about that they don't have the freedom to express their authentic selves, that is no longer there, it's gone. It's tremendously isolating, and it's worsening these symptoms of mental illness or mental health. There's severe loneliness. We're hearing from folks who are in recovery that they've been struggling with relapse. Folks that are in 12-step recovery programs or other forms of recovery programs are telling us that it's just not the same, because that person-to-person interaction, that feeling of solidarity that you get from being in the same space with other people, in a space that you feel safe, and that is what the center represents to them, is the safety, right? Is no longer there. And so they're relapsing, or they're using not just whatever they were using before, but they're using additional substances. So Substance use is on the rise. Here's a quote that I want to share from one of our healthcare partners that, and this is what they stated: many in my personal and professional life haven't touched another person since the beginning of March. It is devastating. So think about that. We're in August. It's almost 6 months. Can you imagine not having had physical contact with a person for 6 months? Humans are social creatures, and we thrive on physical touch. Just that nurturing touch of just a hug, right, can be so reassuring. And so we are seeing this manifest in increased physical symptoms of depression and anxiety, like sleeplessness, abdominal pain, headaches. And this is important to note because our community before COVID, we already avoid healthcare or delay healthcare. And so this additional delay and avoidance is taking a huge toll. And like Maya and Charlie both mentioned, that there's a huge distrust of systems to begin with. So in terms of healthcare, when there's a lack of affirming and culturally appropriate healthcare, that's a huge barrier to the community. It's very traumatic for somebody who has had a name change and is transitioning. When you go to a healthcare professional and they insist on using your dead name. When somebody who is divorced can call and say, "Hi, I'm no longer Mrs. Jones. And I'm getting divorced, so I would prefer you to call me by my maiden name, Mrs. Smith." And the receptionist says, "Oh, okay, no problem. I'll make a note in my file." But when somebody goes in and they're transitioning from female to male and says, "Hey, I'm no longer Jasmine. I prefer you to call me James," and the person insists and says, "Well, no, your file says that you are Jasmine. I can't do that." That is so dehumanizing, and it is so re-traumatizing for the person. Why would they even want to go back? Because you don't know what you are triggering, what trauma you are triggering for a person when you are insisting on going by whatever's in that file. If you can do it for a person that's getting divorced without asking to see a birth certificate and a social security number and all the paperwork, you should be able to do it for a person that is choosing to change their name or has a preferred name. So, that's what is called equity and equality in healthcare. And so, that was already a barrier. Now it's becoming even more of a barrier in terms of, people delaying healthcare because they already distrust the system. There's a lot of medical violence that gets perpetrated towards transgender folk, intersex folk, just LGBTQ folk in general. So people with chronic illnesses like diabetes, high blood pressure, high cholesterol, autoimmune disease are already, they're struggling to maintain their ongoing care management. Here's another quote from a healthcare provider. Coping with the emotional impact of COVID, especially in the context of structural racism that permeates all of the systems that we have to navigate, including the healthcare system, is creating a shift from an acute to a chronic emergency, with our bodies paying the toll. Our bodies are paying the toll. Next slide, please. Charlie already talked about the economic impact, and so I don't want to belabor the point, but I just want to talk again more around the intersectionality when, we already experience poverty at a high rate. And so when you have the intersection of race and gender and sexuality all overlaying on top of that, then, those impacts are further compounded. We already face increased housing and employment discrimination. And so the threat of economic uncertainty, economic collapse already further burdens a already vulnerable group of people. And so there's all these things that we're already impacted by: homelessness, lack of access to educational opportunity, food insecurity, lack of health insurance. We're chronically underinsured. We chronically lack access to healthcare. We chronically lack access to employment. Now, if you're a person of color or you're Black, just take that and multiply it by 5 or 10. And you will see like how that kind of then just ripples out and gets worse. And our trans folk are significantly more impacted by this. Next slide, please. One place that I think that people often forget to really focus on, one segment of our population is our elders. So our LGBTQ plus elders are twice as likely to be living alone and 4 times as less likely to have children. And so they are also at greater risk of having less care in the house or aging in place. They are less likely to have family support when they're ill. And so when all of these factors come together in a time like COVID-19, they're living alone, they don't really have family, they need care, and if they're ill, they're ending up in assisted living facilities or nursing homes, which have been hit the hardest by the pandemic. And so senior care facilities have been those facilities that have experienced really high rates of death. And then when you think about the fact that most of these facilities are not particularly welcome to LGBTQ folk, I mean, how many times have you walked into a senior care facility and even seen a pride flag on a notice board, right? And then think about the fact that this is the generation, right? This is the largest cohort of elder folk that have survived the HIV pandemic. And so they have existing comorbidities and other complications, but they've survived in relatively good health. But they also have the highest risk. But they're also then the most isolated and the most lonely. And so here at the center, what we're seeing is our SAGE program participants are, for them, they are each other's family. They are often the only family that they have. And so when we reopened, our SAGE group was really adamant about wanting to meet in person as soon as possible, because technology is just not working for them. And so here I want to talk about redlining, internet technology redlining. Sometimes when I talk about it, folks look at me like, wow, that's new. And I'm like, no, it's been happening for decades, 20, 30 years, it's been happening. It's just that we've not thought about it in that way. But there are parts of Cleveland that where you are on one side of the street and you can have high-speed internet, and you go across the other side of the street or a couple of blocks down, and your phone company will say, sorry, we don't provide this service in your part of the city. That is digital redlining, and it holds people back. And if you think about it, with Cleveland being one of the most segregated cities in the country, who are the people that are being left behind? It is predominantly people of color. It is predominantly people who are of low income. And so these are some of the things that we have had to consider as we have redesigned our programs to be virtual. So when we closed on March 16th, which was a Monday, the following Monday, we were back up and running virtually. All our programs were offered virtually. And so, you know, what we noticed was, yes, we were having a wider reach, because, you know, as the center, we don't just serve Greater Cleveland, we serve Northeast Ohio because we are the largest community center in this region with the capacity and the consistent programming and the structure to be able to meet that need. However, so we were reaching all these people in Geauga County and Lake County and Ashtabula and Lorain and all these places, but we were missing our regular folk, especially in our youth program. And so then that forced us to kind of rethink, okay, how are we reaching our youth who were regular youth in our youth program, and were predominantly youth of color. And we learned very quickly that most of them were unable to join our virtual program because they lacked internet access or their phone didn't have enough data. So again, internet, digital access, or they didn't have the technology. So they didn't have a smartphone, they didn't have a laptop. And the same thing was with our adults. No consistent internet access, no consistent phone access. If they did have a phone, it was maybe a flip phone. You can't get on Zoom or do anything on the internet with a flip phone, or no laptop or a tablet. So we've been trying to find ways to get our folks connected. I know CMSD is trying to do a really great job with getting CMSD students connected using to hotspots and laptops. But we serve youth that go to charter schools. What's the plan there? What about that cohort of youth that are between, you know, when they graduate and they're up to 24 years old, where do they go, right? The libraries are closed. Other places like job centers and things are closed, but they're trying to look for jobs. They're trying to access resources. And right now, when we look at healthcare, we look at access to economic opportunity. We look at access to just supports and resources like the center. When everything has become this virtual service model, how are folks supposed to access these virtual services and telehealth, right? Especially telehealth services, including mental health services, when they don't have access to the virtual resources to access these virtual services? What are we doing? What are we, you know, how are we expecting these folks who need these services the most to be able to access these services? So that's one thing that we are paying a lot of attention to and trying to find ways to get funding to launch a tech loaner program for our folks so that we can loan out these devices and get folks connected digitally to access these resources. And so next slide, please. Because I'm not sure if I have a lot more. Oh yeah, so I mean, I'll get to this slide in a second, but this brings me to another point about organizations that are serving LGBTQ folk. There's very few of us, and we are chronically under-resourced. And when the need is so high and we are underfunded to support the capacity and infrastructure that is required to pivot to this virtual hybrid mode of serving our community, right? And as the community center, we serve all in our community, right? Whether you are, you know, whether you have the privilege of resources or whether you are the most marginalized in the community and you don't have the resources. But as those of us who work at the center and at the other community organizations that are out on the front line doing this work, we are the people that we serve. We are the same people that are in the community that are also doing these frontline jobs, that are also working in the social service sector. And so I think that we need to come together, you know, and work. The philanthropic community needs to come together and work with us and find ways to really, I think the question is, how are they moving the needle so that those of us that are doing this work to really serve one of the most marginalized communities in our city and in society, to make sure that we have the resources to really meet these needs that are popping up. And so in this context, when I'm talking about communal grief and communal loss, right, we are facing a loss of safe spaces, social contact, and many of the other liberties that were very hard fought and are at so much risk, especially right now in the socio-political context. And this was before, you know, our loss of freedoms and liberties was already sort of up in the air before the pandemic, but now it feels even more jarring and even more real. And so, especially for our elders, our youth, and our trans community, this is really, really jarring. And then, you know, when we think about even our college students, our school students, you know, people have switched to remote learning, and campuses have limited the number of people that can be on campus. They're expecting that folks can be at home or even have a home. But for LGBTQ plus folk, often home is not a safe space. And so for many of them, they don't have a home to be in. There was a recent news report that talked about over 2 million college students don't have access to computers or internet. How are they supposed to be online to take college classes virtually? And so the closing of many of our LGBTQ spaces are not just, you know, bars, but also cultural spaces, right? So even when the center had to close between March and June, the center is not just a community center, it is a cultural center. It is for many of us, it is home. It is the one place that we have where we can be our authentic selves, feel accepted, feel affirmed, know that we have a place to go if we need a shoulder to cry on, if we need to get connected to the right resources. Many of our community folk reached out to us while we were, you know, we had a virtual front desk and all of that. And they just missed the staff. The center, what makes the center is the staff, because we have built these relationships with our community members that we serve. And often for many of them, it is that relationship that they missed, that they just wanted to be able to come to the center for even like 5 or 10 minutes, just to be able to have that reassurance of physically seeing the center staff that they know deeply care about them, and be reassured that the center isn't going anywhere, right? That the space is not gone. The center still exists because the staff still exists. And so in a time where we're facing increased economic uncertainty, I think that we have to rethink the way in which or community organizations that are sort of this, you know, root the community and ground the community. How is the community philanthropy? How's the community coming together to make sure that they are able to weather this pandemic, weather this uncertainty? And I think that we also, you know, I think it's been made clear that the way that we think about funding and finances around nonprofits is we need to rethink that, because we need to allow nonprofits to be more agile, right? Because we have to be really agile and flexible and adaptive in order to continue to be responsive to the community and continue to serve them where they're at and meet their needs. I think that we also have to think about the people that are out there serving the community, who are also the same people that we serve at the center. And they are also themselves community workers and healthcare providers. And what are we doing to make it easier? What are these systems? What are these funders? What are we doing to make it, to ensure that they're safe, because they have high risks too? What are we doing so that people aren't feeling that, oh, I better go to work and risk myself and my healthcare and then continue that transmission to somebody else because, you know, I don't have a paycheck, because I live paycheck to paycheck, because people, you know, the philanthropic sector doesn't think about, okay, longevity of the people that work in nonprofits, right? So these are all the things that I think I'm hoping that it's making us think about as a conglomerate of organizations that are really, really committed to serving the disenfranchised, serving the marginalized, serving those who are the most vulnerable in the community and who we are a part of. We can't forget that. So whatever we want for ourselves, we should want for everybody else. I think I'm going to end.
I'm going to have to interrupt here. We've gone a little bit over, but I really appreciate your remarks. I think I'm so grateful for everybody's work. I mean, I think your presentation, Gulnar and Maya and Charlie, it really underscored why it was so important to have this forum today. I mean, you give me some things to think about that I hadn't thought about before. And I really, really appreciate that. I think I know we had some questions in the chat box. So what we'll do is we will follow up with our panelists and get some answers to those and send those out to everybody who participated today. But I really appreciate all of you being with us today. And I think you've given us, I think, both some things to think about, but also some things that we need to think about in terms of from a policy standpoint. So we appreciate that. And we want to keep lifting these issues up for our community and for the community at large. So thank you very much. We appreciate everybody who joined us today. And we look forward to doing similar programs like this in the future. So thank you very much.
Thank you, everyone.
Bye-bye, everybody.
Thank you.